Hi friends, today we are going to discuss about a 10-year-old girl child with a fever of more than 2 weeks duration without any focus. I am Dr. Sharad Balaji. Welcome to our video 14 of our YouTube channel. And this 10-year-old child with a weight of 30 kgs and a height of 130 centimeter, both are appropriate for age, which indicates that there is no underlying chronic illness so far. But for the past 20 days, there is some kind of fever, daily fever, continuous fever, more so in the evening. But at the time of examination, she doesn't look toxic. There is no cough, weight loss, appetite loss, or a contact with the TB. Right. There is no headache or altered sensorium to suggest an infective cause of subacute meningoencephalitis. There is no skin rash, yashar, oral ulcer, joint pain, bone pain to suggest a connective tissue disorder or a malignancy. There is no recent travel to malaria endemic region or no animal contacts to suggest leptospirosis, brucellosis or myelidosis. Her head, eye, ENT examination are absolutely fine. No peripheral lymphadenopathy. Chest clear, no hepatosplenomegaly, no dovey abdomen, no neck stiffness or neurological deficit, no phlecton or erythema nodosum. In all these pyrexia of unknown origin, always look for indirect evidence for TB. These phlecton and erythema nodosum are nothing but nature's mantle. And regarding vitals, heart rate 100 per minute, no murmur, respiratory rate normal, air entry equal, BP normal, a temperature of 101 degree Fahrenheit. Can it be tuberculosis? There is no weight loss, no cough, no appetite loss, no contact. So can it be TB? Less likely. Can it be an enteric fever? Enteric fever of 20 days duration. By this time, she should have developed some kind of toxicity, but she doesn't look toxic. But the child has been receiving cefixime for the past 7 days. So we don't know whether we need to add some other drug such as macrolide. Still, it could be an enteric fever. Still, it could be a tuberculosis because the two most common infective causes for pyrexia going to the second week in our country is usually tuberculosis and enteric fever. Can it be complicated UTI? So far, there is no urinary tract infection. UTI occurring at this age group, less likely, unlikely. Can it be a complicated pneumonia? Respiratory rate normal, air entry equal, less likely. No, it can't be. Can it be a brucellosis? Brucellosis, by this time, you need to have an hepatosplenomegaly or a joint manifestation or small satellite abscess somewhere else. No animal contact, no raw milk ingestion, less likely. Can it be scrub typhus? Scrub typhus, by this time, if you had not given any treatment with the doxycycline, by this time you would have developed an encephalitis, hepatitis, nephritis, or a pneumonia. But these things were not there in this child. Can it be a connective tissue disorder? So far, there is no skin, joint, mucosa, serosal involvement. So less likely. Can it be a malignancy? What malignancy you can have without any fever, without any focus? Can it be a neuroblastoma? Can it be a blood tumor, ALL, or can it be an underlying Wilms tumor? But age doesn't look fit into these malignancies. Can it be drug fever? Can it be drug fever? Because the child doesn't look toxic, there is no focus. Can it be drug fever? Can this be fever due to cefixime? Any drug, in fact, can produce drug fever. Right now, we don't have any clue towards any of these diagnoses in this child. So let's go and do a CBC. Look at this. Total count, neutrophil, lymphocyte, hemoglobin, platelet absolutely normal. ESR, CRP, non-specific markers of inflammation, little bit high, but doesn't suggest any infection or an inflammation in this case. Culture, urine culture, blood culture, negative. Vidal, still in our country, people do Vidal to search for an underlying tuberculosis. Despite that, Vidal turned out to be negative. Serology for scrub, lepto all turned out to be negative along with the smear negative for an malarial parasite. Still, do you think, is it a case of tuberculosis? ESR should be little bit high, but we don't usually get any clues apart from ESR in our CBC. Can it be enteric fever? Enteric fever will have a leukopenia along with the eosinopenia, but we don't have such things here. A complicated UTI, no, your urine cultures are normal. A complicated pneumonia, respiratory rate is normal. Air entry equal, no added sounds. Do we need to take an X-ray? Let's see. Can it be brucellosis? Again, can we? But so far, the serology for brucella has not been done. So it can be. We will have this one in our next investigation. Connective tissue disorder, girl child, again for an SLE, a disproportionate ESR and CRP will be there. ESR will be high, CRP will be low, but it doesn't look like a case of an connective tissue disorder. Malignancy, bone marrow malignancy will have anemia, thrombocytopenia, bicytopenia, no such things. Still, can we suggest a drug fever apart from all these, beyond all these investigations, because all turned out to be negative? It can be, it can be. So what next, my dear friends? What next? Shall we do a manto? X-ray chest, the child is absolutely normal with respect to respiratory examination. Do we need to do an X-ray chest in this case? An ultrasound abdomen, echo, fundus to look for choroidal tubercles, lumbar puncture without any altered sensorium or a neurological deficit, uric acid to search for underlying occult malignancy, PET-CT to look for an active focus of infection or inflammation, so that you can choose a biopsy from this, from any of the site. So let me give 30 seconds duration. Kindly choose your investigation of choice. Which one you want to do right now? Manto, X-ray chest, ultrasound abdomen, echo, fundus, lumbar puncture, uric acid, PET-CT. Which one do you want to do? Okay, time is over. Look at this X-ray chest. What you are seeing here, look at this. There is right paratracheal adenopathy and left paratracheal adenopathy. So this is a case of mediastinal lymphadenopathy, and the manto turned out to be positive. And when we took a contrast enhanced CT scan, you could see necrotizing mediastinal lymph nodes. Along with that, your ultrasound revealed many periportal hepatic nodes. So what is the carry home message from this case? Even though we don't have any direct evidence for TB, it is more in favor of TB because of the necrotic mediastinal lymph nodes along with the manto positivity. It can also be lymphoma, but it is less likely because she doesn't look toxic. So the carry home message from these cases, from this case are, look at this: in fever without focus, which lasts for more than 1 week, even when there are no symptoms suggestive of respiratory system such as tachypnea or your cough, or any sign suggestive of respiratory system such as reduced air entry or added sounds, it is mandatory to take an X-ray chest. I repeat, it is mandatory to take an X-ray chest, because many a times X-ray chest helps in demystifying the mysteries behind this pyrexia or fever of unknown origin. And also one more point, some tuberculous diseases such as TB mediastinal lymphadenopathy, TB pleural effusion, TB cervical adenopathy, they do not need to have loss of weight or loss of appetite. So probably this is a case of tuberculosis involving the mediastinal nodes. Again, the carry home message is, even when there are no signs and symptoms suggestive of respiratory system, if fever crosses 1 week of duration, kindly take an X-ray chest. Thank you.